Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to Sensei Podcast. It is my great pleasure to introduce our guest today, Dr. Jesse Kane from the University of Vermont, where he's leading the complex and CTO program. A great friend, great CTO and complex operator. Jesse, thanks so much for taking the time to be in the podcast today.
Yeah, thank you so much for having me. Really, it's great to be here.
Jesse, I always want to start from the beginning, how things happen. And I just was happened to Google your name and the Waldorf School came up.
Yeah.
And I wasn't familiar with it, but won't tell us how it is and did that play a role to you becoming what you became?
Yeah, both my parents are actually teachers at the Waldorf School, which is where I did all my education, early education. And it's interesting, the focus there really is on arts, creativity with less of a focus on science. So, you would study science or you would study things, but it would actually be about like creating textbooks. So one of the main things in the education or the curriculum is you actually create your own textbooks. So it's a lot of generative thinking, coming up with your own ideas and really exploring things and experiencing things. And so it wasn't really until college that I started to have a more strong science background, but I think that's been a big part of kind of informing who I am, being creative, being more in terms of producing ideas almost as an artist would. Not saying that I'm like an artist in the lab or anything, but the idea that there's a lot more to it than just the data and the analysis, and that there really is an art to medicine is something that's always been very important to me.
Wow. So Jesse, and then how did the Waldorf School prepare you for the subsequent steps? And then I think you went then to college and medical school, and how did that early training translate into, I think you did neuroscience, right?
Yeah.
So you were not in the cardiology. What happened there?
I think it's all just been a process of development. I think from a very early age, I knew I wanted to be a physician. And so even when I wasn't doing things that were directly related to biology or any of the major sciences, I always had this perspective of how do you apply art, how do you apply humanities to your medical practice, even from an early age. And I think I got a lot of guidance and balance. I did a liberal arts education at Oberlin. I went to Tel Aviv University in Israel for medical school. And you get so much more than just an education in science and how to treat patients and data analytics, which are all obviously, talking to you, like, how important those things are. But there's a lot more that we do in medicine, and especially CTO PCI, when so much of it is really understanding your patients, really understanding what they need and what their values are. That goes beyond just kind of the data analytics, understanding guidelines and understanding physiology. So I think it's just been a natural progression over time.
Well, so, everyone says these days that if you want to do medicine, you should go into science, biology, and you had a different route, which turned out to be very good. And actually, neuroscience, for many people, is also one of the big frontiers of the current medical practice. So maybe it's also, in a way, similar to the CTO complex, which is still getting better, but still one of the major challenges.
Right.
How did you decide to go to Israel for the training, for the medical training?
I think it was kind of twofold. One, I thought it was the best med school that I could get into. So I was just, taking that opportunity and getting the education. But I also think I was at a point in my life where I wanted to explore something. I wanted to take a different path than a lot of my colleagues have been doing. And again, I've always viewed myself as kind of developing the whole person, right? And I didn't want to go to some place where I would just sit in the library and study all day. I wanted a place where I get some cultural enrichment, see how things are done a little bit differently in a different part of the world. And, I think that's informed a lot of my practice. And, the CTO community and the interventional community is a lot of people from all over the world. And I feel like having some experience being an outsider has kind of helped me relate to people a little bit better. So.
Wonderful.
Yeah.
And then you went through residency and fellowship. And then how do you decide now, after all these years, to go into the CTO and complex PCI?
Yeah, I think uh, I've always loved interventional cardiology because it's like instant gratification, right? Like, especially ACS or STEMIs, patients coming in, life-threatening emergency, you open up the artery, they feel better like that.
Yeah.
But, when I started doing more cases in my general fellowship, I started to realize that a lot of patient management was predicated upon operator skill set. So the type of therapies or the quality of intervention that some people would get would vary, not based on how they were presenting or who the patient was, but who was treating them. And I realized that if I'm going to be putting pieces of metal in somebody's body, that, I have to be doing that at an extremely high level. I don't want to just be mediocre and get through with what I need to, but to try to do it at the highest level. And, watching your videos, seeing Bill do live cases, seeing people really inspire at the very highest level had an impact on who I wanted to be as an operator. And that's why I decided to do that chip year and kind of advance my skill set to really bring something.
Wonderful. And then you also trained with Bill, so you had a lot of exposure to complex, high-risk cases. Many people in the same crossroads in their life, so to speak, they elect to just go into practice and do some proctoring cases and attend courses. Yours was a more direct route. You go spend an extra year. So there's always this balance that it's an extra year, it's less salary, it's more time, and you've been already training for a long time to get this point versus and getting more case exposure versus starting the practice and then slowly building it up. So how did that equation, and obviously you had the holistic thing from early on, how did you decide one versus the other?
Well, I saw Kate Carney at a conference talk, and then she's very open. She always has her number or whatever at the end of her slides. So I called her and I asked her that question, and I said, I'm looking at some practices. I was interviewing for jobs in regular practice while I was applying for CHIP fellowships. And I was like, why should, what do you think? Is there a real benefit to this? And, basically what was explained to me and what I've come to learn is when you do these years, it's so much more than the techniques that you learn, right? Like you learn how to deal with complexity, but you also get in the minds of some of the most skilled and experienced operators in the world. And you're dealing with them every single day. So it's not just that you're learning these skill sets, but, and I know you have your CHIP fellows as well, but you impart a little bit of that onto, your trainees. And I realized that to have a direct relationship with Cade and Bill and Lorenzo in that lab was so much more valuable than just, doing some CTO cases and feeling good and having, somebody watch me a few weekends a year. So that was a big part of it, just that relationship aspect to it.
Wonderful. And you're right, there's so many things that go beyond the actual doing the cases, a lot of the planning, but also the thinking, how you approach the complications and everything else. And what was for you the hardest part of that year? It's obviously an intense year, doing a lot of complex stuff, but what do you find the hardest?
There's a lot of hard parts of that year. And I spoke to Salman about this as well. Like, a big aspect is you're constantly failing and then seeing somebody just come in and do it very, very easily. So I think it's very humbling to I was at the end of your general interventional year, your first interventional year, nobody's taking over your cases anymore. You're doing the cases, your success rate's like 98%, you're good, you feel good. So you come into that chip year with that confidence, and then you're constantly failing, especially starting out. You're just failing cases, and trying to get a win. And then somebody like Bill comes in and is like, breathing and just kind of like does the case very quickly. So it was very humbling, just to maintain confidence, keep trying even when you weren't successful initially. So, yeah.
And then apart from that, on the technical side, what was the more difficult thing for you in terms of learning? Was it the algorithms, the thinking, the technique? What was the thing that you found the most challenging?
I think the thing is patient stability and time, because you can get things eventually if you have an infinite amount of time. But if you're going retrograde in the patient, I had this, one of my first retrograde cases at UVM, or going retrograde, nobody's going to come in and start working faster than me. And I can't get the equipment quickly enough. And in my head, I'm seeing the pressure go down, and I'm realizing, I'm retrograde. I got a retrograde wire up, but I'm not working fast enough yet. So, I'm realizing that even when you have the skill sets or when you know the techniques, or, you can get things done, sometimes it's the efficiency aspect of it. And that's a team sport too. That's, getting the lab with you. That's you knowing the patient and knowing when you're going to have to be quick to get things done. So I think it's hard because you can't, it's not like a technique that you can learn. It's just like a instinct that the patient's not going to do well like this for a long period of time. So, yeah.
So, and then you're right. If you're seeing that, then how can you work fast enough? That means you internalize the process so you can get the retrograde quickly, get your reverse card set up and move things quickly, which again takes time and effort as well. But you're absolutely right. Efficiency is a big part of getting better. Now, in the new place that you went, in University of Vermont, how did they approach it, and were they welcoming? Are they supporting? How did that help in building up or helping build up the new program?
Yeah, I think one, I needed to be in a place where they're supportive of it. And so that was a big part of my interview process. Talking with Harry Darman, who's kind of director of the cath lab there, about doing complex cases, taking on risk, and using up cath lab time to do the cases, when resources are limited. So I think I did a lot of work before I got there in terms of really setting expectations and letting them know what I was trying to bring in. And I think explaining the cases that we do now, bringing them up at heart team meetings and kind of describing and following up with how the patients are doing has been really, really valuable. So it doesn't just seem like I'm putting a bunch of wires places and then, taking 3 hours to do something. So, yeah.
Wonderful. And then in terms of the cath lab, the personnel, and teaching them and helping them reach out, helping me welcoming, do you select them, or do they kind of self-select the people who are interested in this line of work?
I think, I've done a lot of teaching. In Vermont, it's interesting because we don't have techs. We only have nurses.
Okay.
And so you scrub with either a fellow or they have APPs who will scrub with you. But I've done a lot of kind of education and trying to do things like just dual angiography in case, we've done a couple STEMIs where there's some collaterals, and I'll do the dual angiography just so people can get used to the two manifold system and explain why that's happening. So finding opportunities to teach, we've done some didactics together, but also kind of clinical learning. And I've learned that the most important thing is just communicating what I'm doing and explaining it the whole time. Every case I'm doing, I used to just kind of get the case done, be quiet. I'm talking through literally everything now, trying to explain exactly what's going on. And that's been really helpful because you get buy-in from people doing that, for sure.
Perfect. I think they also learn, but I think you also maybe realize some things, but try to explain them. You may realize some things that you might otherwise not have appreciated when you were before you began
that's what haunts me now is, when the fellow asks me a question, because I'm not used to working with fellows under me and I don't know the answer to it. I'm like, this is pushing me. This is pushing me to get better. So it's
that's the key. You have to ask the question first.
Right.
Okay, what do you think about this?
And right, exactly.
No, but it's true. Actually, working with fellows as well just gives you different perspective, because the reality is, if you do something for a long time, then sometimes you get your thinking going in one direction, and maybe there are different, fresh ways to look at things as well. So
absolutely.
In terms of the hard parts of the job, so failures, complications, how do you deal with that? Do you have any? Do they affect you a lot? Are you able to overcome them quickly? How does this work for you?
I think the failures I've kind of become more okay with. I think that's part of the chip year that we talked about. Is you get used to that, and you know that you're growing, and then you try to talk it over with somebody, and that's a good learning opportunity. I think I've struggled a lot more with the complications, because sometimes you feel just so terrible that it's hard to have a productive conversation about it, and sometimes you don't know what happens. Sometimes patients don't do really well, or it was a reasonably sized NC balloon you went up with and it just perfed, and you don't know what you would have done differently. So yeah, no, it definitely gets to me. and something I struggle with a lot when I have those complications. But I think what's helped is talking with people. I talk with my co-fellow from last year, Jasleen, a lot about any issues that I have, talk with family about just kind of what I'm feeling. And usually after a week or two, I'll review the case and try to figure out what I could do better, and, talk with mentors about what's the better option here. So yeah. So it's a long answer short. It's a 2-week recovery process, and then you get back into it and go.
Perfect. And I think also one of the other people, I think Catherine Kunkel says that, the trying to keep it private is the worst thing. What you want for these things is to actually talk over with people. That gives you more opportunity to reflect over it and move on and get better.
Yeah.
So
that's one thing I always wanted to ask you, though, is that you're very systematic in your approach. Do you have like a structure for dealing with complications? Like, how do you have a process or recommendations for like the steps that you take for it? Like,
you mean for a specific complication, what to do, or the process if a complication happens, how to?
So not complication management, but your personal handling of a complication after. Are there steps that you take afterwards? Is that how you think about it? Or?
Well, I mean, you can call it steps or approach. The approach is obviously the first line is you go over with the family. The second line is you go over with the lab. The third line is reaching out to other people, either inside or outside the lab, to get opinions. And the fourth part is that healing part, the phase where you just go over it, look at it again. Ideally, actually, I like the same thing, what you say, just give it a few days. I mean, if you go immediately, sometimes you may be a little overly critical. I mean, you look at it again, but I mean, to really dive deep into it.
Yeah.
And for me, the last step is actually, I make a video out of it. So then it's out in the open, and actually, quite often when I take the video, I've got a lot of opinions from other people. You could have done this, or you could have done that. And then that comes out as a potential thing for other people to see as well.
Right.
So I think, I mean, for me, the case I learned the most are the complications. And I think most people learn the most from their or other people's complications. So the more you can do, the better. And I mean, example for me, I had this wire stuck, and Bill Nicholson just came out with this paper, wrote up later, cutting the wire that's stuck that can get removed. So there's small things like that had I known a year ago or whatever would have happened, hey, maybe that would have been better. So It's a multi-stage process now. Also, it's an algorithm style, but these are the key elements, I guess.
Yeah, it's like the shameful floral save. Like, you see something happen, it's bad, and you're like, floral save that. Like, it's someone's gonna want to talk about this later. So yeah.
Yeah, I cannot agree more. Now, in terms of you're approaching, you're now teaching other people, right? So you have this unique perspective because you were recently being trained, but now you're training other people as well. So from the things that you are now finding the most difficult to teach the fellows, what are the things that bother you the most, or are the most challenging for you to achieve?
I mean, I think I have to work on my patience. I think that's been the biggest aspect, because you want to, especially if you're doing a complex case, you want to get things moving. You don't want to be in the lab for 4 hours. And so there's this balance that I'm struggling with right now of how long do I let the fellow work? How long do I let them wire? And then when do I take over? And it's a tricky component. I think the nice thing, I was worried because, I came in around a month or two into their interventional year, and I was a little worried, what they're learning and are they going to have my style? Who are these people? But they've been really, really good. And I think we've had a lot of dialogues about me learning to be a teacher and trying to make it mutual, almost like they're teaching me how to teach and I'm trying to teach them how to do PCI. So we've had a lot of kind of back and forths, and I've tried to be more like, I'm taking over now because you've wired for 30 minutes and we're going to switch. That's the strategy. So it's a balancing act, but I'm fortunate that the fellows are really understanding of me being new to this as well.
Absolutely. And this is something that it's evolving, and the types and the skills change, and every person is different, right? So even if you have your style, I mean, every person needs different things to be able to be done to make it more effective for him or for her.
Yeah.
In terms of learning, obviously you're one of the best labs in the world, learning with the key people on the area. What helped you the most with learning?
I think watching live cases is really, really valuable. Recorded live cases. I think it kind of depends on the skill set. Honestly, I read the manual of CTOs before I started my interventional year because I think you need some type of foundation, or at least I did, because I couldn't learn without understanding the terminology. So for me, it was the terminology first, reading those books or watching the YouTube videos, honestly, and then once I understood the terminology or the techniques, then just watching case after case online, going to conferences like CTO Plus and seeing how they handle things. And then, just trying to expose myself to as many cases if I'm not in the lab doing it myself.
Perfect. So, I mean, again, everyone has their own style, but you're right. End of the day, you need to be doing those cases yourself to get good at them.
Yeah.
Now, how do you keep fit or relaxed and in good shape? Do you exercise? Do you do some meditation or something like that? No, you've been a big lacrosse player from what I remember.
Yeah. So, I mean, athletics has always been a big part of my life, and I think you need the balance. So I just have like the setup in the morning. I get up early. I do a 20-minute meditation, which was very hard for training, but now that I'm attending, I have a little bit more control over the schedule. So I try to have a daily meditation practice in the morning, quiet, nothing else going on. And then in terms of exercise, I wish I could play lacrosse, but I don't think my body can handle it as much anymore. So I've been doing a lot of just cardio and I have a Peloton bike and, very simple stuff that's easy for me to do. Because if it's challenging or there's barriers to like going place, I'm not going to do it. So I just, have something set up in my house and just go for it.
Do you have your favorite meditation technique? Is there a specific thing you do, or is it more breathing, or how do you do it? How does it help actually with your day?
Yeah, so I've used the Headspace app. It's just guided meditation. I'm not very good at meditating, so I find like guided meditations are a lot easier than just sitting in silence or trying deep breathing exercises because I will lose focus. And then I try to set an intention for the day, which has been really, helpful. I know this might sound like kind of hippie, but like if I have CTOs lined up or I'm nervous about a case, instead of focusing on the success or the technical aspects of the case in the morning when I'm nervous about a case, I'll just try to set the intention of being helpful to the patient that day and whatever skill set I have. And I think that helps me kind of calm down before I like go into the room, and it frames the day a little bit better as opposed to, am I going to succeed? Am I not? Is there going to be a complication? Is there not? It's more of an intention for the day that I've set. So, yeah.
I think we should all think about this. You're right. I mean, the goal is to help and you do the best you can, and usually hopefully works, but if it doesn't, the intention remains the same. So
right.
That's important. How about any favorite books or any favorite movie?
So favorite, I have trying to think of anything in particular. So I read a lot of biographies. I think they're super helpful. I'm reading one on Simon Bolivar, the great South American liberator. And I love those books because you hear the names, you hear these famous people, they're super well known, but it's very valuable to see that they struggled or that, what they were like before anyone knew who they were. And so it's really valuable. So I love biographies, and those are pretty much it.
How about a movie?
Movies. I'm embarrassed to say it. I watch probably a lot of rom-coms. It's what my wife likes to watch. We could watch it together. Don't have to think. There's in what we do. There's so much intensity and tragedy and drama naturally. So it's nice to like. I don't need a theatrical presentation of very intense things. So usually just a rom-com. Like not that it's my favorite movie. Like One Fine Day. I think my wife and I were just talking about, or Notting Hill. These are classics. If you have a complication, you watch Notting Hill, you'll be ready to review the case the next day.
So these are key tips and tricks,
right.
I guess, for the
exactly.
for the people. I haven't done it yet, but maybe I should try it the next time.
You should do it. Let me know.
How about any other hobbies? Do you have time or energy or for other things as well?
So I like to write. I don't think anyone would read what I like, to write, but I'll put a lot of my thoughts down either, to process cases or interactions or whatever's going on in the world. I'll put down, short essays, show them to my wife. Nobody else will read them. But I like it. It's a good way to kind of put my thoughts on paper, almost like journaling.
Mm-hmm.
And I play a little guitar. I'm not very good at that either, but I spend most of my time in the lab, so I think that changes it.
Well, like most of us, right? That's
Right.
what happens. But you do
Right.
need that unwinding time
Yeah.
to put things down, calm down, and make sense of
Yeah.
what's been happening.
Yeah. It's also nice to have like to be mediocre at something. Like we're talking about having this high level, like really striving to be very high level and as good as you possibly can be at this one specific thing that we do, right? But it's sometimes nice to just be like, yeah, I'm just gonna play the G chord and I'm not very good, but no one's listening, and it's just for me, so it's good.
Do you think the music helps you with dexterity and the other things?
Not at my level. Probably if you're like a concert pianist, but not for what I do. No.
But do you think like your education, right? You were in the Waldorf school, you had a different, more open and more creative way of thinking.
Yeah.
Than most people, that go to the regimented science, biology, etc. Do you think that's affected the way you approach the complex cases and finding solutions that otherwise you might not have thought of?
I think it's a combination. I think in the clinic, yes, definitely in the clinic. I think it really helps because we talk about and this has come up in the conference too, is what is chest pain, what is ischemic symptoms, and how do you have a risk benefit discussion? And I think that really helps in understanding people, understanding their backgrounds and trying to come up with a solution to help them. I think in the lab, one of the things that I love about CTO PCI is the combination, right? There's a clear algorithms, or there's a few algorithms now that you can follow, but all with a similar approach, what the right thing is to do next.
Mm-hmm.
And so in some ways it's nice that it's confined, but what also is nice is that you can be creative with it because there's a million different ways to do a dissection reentry, right? There's a lot of different approaches you can take when you're going retrograde and troubleshooting. So even when you're following the algorithms and you're nicely, I really enjoy being kind of blocked off in what I could do. There's a lot of creative ways that you can approach the challenges that come up as you follow the algorithm. So it's, I think, a combination of those things. Yeah.
And then when it comes to intervention right now and the upcoming things, both technical, equipment-wise, what are the things that you find most exciting and interesting for what we do?
I really like the idea of the literature that's coming out on investment procedures, like SPAM and STAR. And I think, we've gotten to a point now where technical success is pretty high. And the idea of doing a procedure and trying to reduce these perioperative risks is, I think, a new frontier. Once we get these procedures to be lower and lower risk, I think there's going to be a lot less barrier, and these conversations with patients are going to be a lot less easier when you don't have to quote them somewhere like a 5 or 6% risk of MACE. And I could just say, we have these techniques, I'm going to stage it. And, I'm throwing out numbers, but if I could say that risk is much lower now, it changes the conversation. And it's starting to impact my practice. We had a patient the other day, low EF, very tortuous circumflex. And I told her up front, we're just going to STAR this. There was only like an epicardial collateral. I didn't want to put an Impella in. Yeah. So it's expanding the options, but we still don't quite know what to do with it. So I really want to see where investment procedures go and take it from there. Yeah.
What are you most proud of the things you've done so far?
I could have a million cheesy answers. I think that I don't think I've lost the reason that I came into medicine to begin with through all my training. I think I did 9 years of training, right? And I think you can get jaded, and there's a lot of things that can pull you in different directions as you go through that long process. But I think I'm most proud of, if I looked back at my like med school essay, that I think I've tried to hold to those values and not get influenced by some of the aspects of, medicine in America and, everything that goes with that. So, yeah.
Wonderful. And then what are your plans for the future? Where do you see yourself in 5-10 years?
Well, I really love the job that I'm in now because it's an opportunity for growth. And my hope is to really build out a program, and to serve a community that I think has an unmet need at this point. So in the next 5 years, I really hope to build out the CTO and complex PCI program at UVM, and continue to develop my skill set and hopefully become a better teacher as well as I get more and more used to having fellows around. Yeah.
Well, those are some lucky fellows over there. So, Jesse, if you had some new people and they're starting, either in fellowship or they're finishing fellowship, starting practice, and they want to follow this same pathway of complex CTO, based on everything you've done, what do you think works the best? What would you recommend them to do?
I'd say reach out to people like you, reach out to, people like Bill, because what I learned is a lot of people who you might be afraid to talk to are extremely, extremely open. And that it's a very welcoming community, CTO community, where people want to share their skill sets and mentor people and bring them along. And so I think the best thing, I did was get over that fear of talking to people and force myself, in a very authentic way of just trying to connect, trying to understand people, and reach out to them because they're going to help you. And that's the best way to get mentorship, proctorship. Even if you don't do a CHIP fellowship, having a proctor come, I think that's a really good way to get started.
Perfect. And then obviously you chose the pathway of the dedicated training and getting up front, but for people who decide to not follow that pathway for, personal or professional reasons, as you mentioned, just getting proctoring, what would be your recommendations on how to build on their skills, even though it's a different environment?
Yeah, I think there's a few different ways that you can develop your skill set. One is, again, that like what I talked about learning, picking up one of your books, watching some videos to get the vernacular. It's like learning a second language, right? So understanding those components is going to make it a lot easier when you're getting proctored. If you don't know what an ADR stands for, then you're not going to get a lot of utility out of somebody telling you how to use a Stingray, right? So I think definitely take some time, read some literature, watch some videos, watch some live cases, and then again, reach out to the people who are doing the case that you just watched on YouTube. Like reach out to them, send them an email and say, I've got some cases. I'll, if they're in your area, refer them the cases. And if you're very, really early starting out, refer them the cases, then go to their lab and watch them do the cases. The patients will love you for that. Like, oh, my doctor cares so much, he came to the lab to see the case. And then as you progress there, get some proctorship, have somebody come to your lab. It's the best way to learn.
Yeah. No, I love your approach. It's like anything else, right? You start from the basics, you get your basic understanding first, and then you build on it. And end of the day, you have to do it. And there's nothing like a good teacher who can help you work. But you said your teacher comes in and the student has no idea from the basics, then
Right.
It's not going to go as efficiently as it could have if you have the basics. So
Yeah, exactly.
it's a multi-faceted approach there.
Yeah, absolutely.
So Jesse, thanks again. I appreciate you taking the time today.
No, this is awesome. This has really been great.
It's, congrats on you setting up the new program at UVM. It's going to be phenomenal and can't wait to hear more great things happening over there.
Thank you, really.
Thank you for listening to the Sensei podcast.